Hey there, future doctors. Today I'm going to show you how to perfectly measure jugular venous pressure, or JVP. This technique is essential for assessing a patient's right atrial pressure and overall cardiac function. Let's dive right in. First things first, patient positioning is crucial. Make sure your patient is positioned at a 45-degree incline. This angle allows the venous pulsations to float below the clavicle, making them easier to observe. Next, ask the patient to turn their head slightly away from the side you're examining, usually the right side. This helps straighten the course of the internal jugular vein. Alright, now let's move on to identifying landmarks. Locate the sternal angle, also known as the angle of Louis. It's the junction between the manubrium and the body of the sternum and lies approximately 5 centimeters above the right atrium. You can gently palpate to find this noticeable ridge. When it comes to veins, focus on the right internal jugular vein. Although the external jugular is more visible, the internal jugular's pulsations are more directly transmitted from the right atrium. Look in the jugular fossa, between the clavicle and the heads of the sternocleidomastoid muscle. Now, let's talk visualization. Good, indirect lighting is your best friend here. A tangential light source from above or the side helps accentuate the venous pulsations. Look for a pulsation that's soft, has a biphasic waveform, and can be easily obliterated by gentle pressure. Unlike the carotid pulse, venous pulsations are larger, undulating, not palpable, and affected by respiration. They often diminish on inspiration. To differentiate from the carotid pulse, remember that the carotid appears as a single, brisk pulsation. In contrast, the JVP has a subtle double appearance, reflecting the A and V waves. Alright, now for the meat of it, measuring the JVP. Locate the highest point of venous pulsation and imagine a vertical line from this point down to the sternal angle. Because the sternal angle is roughly 5 centimeters above the right atrium, add 5 centimeters to your measurement. For example, if the highest point is 3 centimeters above the sternal angle, the estimated right atrial pressure is 8 centimeters H2O. A normal JVP is usually less than or equal to 8 centimeters H2O. Values above this indicate elevated central venous pressure. Elevated JVP can suggest conditions such as right-sided heart failure, constrictive pericarditis, tricuspid regurgitation, or volume overload states. Abnormalities in the JVP waveform can also provide additional clues to underlying cardiac conditions, such as a prominent A wave or the absence of the A wave in atrial fibrillation. Here's a quick flowchart to sum it all up. Position the patient at a 45-degree incline, turn their head slightly away, identify the sternal angle, visualize the right internal jugular vein pulsations, determine the highest point of pulsation, measure the vertical distance to the sternal angle, add 5 centimeters to this measurement, and interpret the result as normal or elevated. Remember, patient comfort is key. Ensure the patient is relaxed, as a tense neck can obscure venous pulsations. A quiet, dimly lit room is ideal for visualizing these subtle pulsations. If you're having trouble, slightly adjust the patient's position for better visualization. Always interpret the JVP in conjunction with other clinical findings to arrive at a well-rounded diagnosis. That's it for today, folks. Mastering JVP examination is crucial for diagnosing conditions like right heart failure and understanding a patient's hemodynamic status. If you want to explore more, we can delve into the nuances of venous waveforms or how ultrasound enhances our ability to quantify central venous pressure. Thanks for watching. Don't forget to like, subscribe, and hit that bell icon for more medical insights. See you next time.